Well, I'm a family nurse practitioner. I also do a lot of ER. And I think, and I'm in academia, so one of the things that I think is really important for nurse practitioners to do is to develop relationships with other providers. So other specialties, so that when they need to refer, when they need to ask a question, they have somebody that they can call who will answer their calls and pick up the phone and give them advice or information to help them make an appropriate diagnosis or treatment plan. I have been a nurse practitioner for 25 years, and I am a family nurse practitioner. I recently went back and got my psych mental health certification, so I'm now dual certified. And I started out in rural South Carolina. I spent about 8 years in a federally qualified health center and in a rural hospital. And so I did clinic work, and I also was a hospitalist, and I worked in the ER there, and I developed a fast track for our ER there. And so we moved back from South Carolina to Florida, and I've been in family practice and urgent care and ER. And then I went into academia, so I've been teaching on and off for about the last 14 years, and I'm now with Loyola in New Orleans teaching. I teach because I think it's important that we educate nurses to further their education. It's really important that they continue with their education. I feel that learning is lifelong, and we need nurse practitioners to fill the gap of primary care. So I really encourage nurses who are interested in progressing in their career, if they're not happy being a registered nurse and want to do something different, to look into being a nurse practitioner and serving their community in that respect. I think nurse practitioners have a unique place in primary care because they fill gaps that frequently other providers are not willing to fill. So as we know, a lot of rural care is given by nurse practitioners, and a lot of inner city urban care is provided by nurse practitioners. And so there are a lot of areas in this country that are rural that need our services, and we're willing to go there, and we're really willing to serve people where they're at and fill in those gaps. So I am chair of the fellows at AANP, and the fellows group is it's a program of AANP, and we recognize nurse practitioners who have made outstanding contributions to the profession in 4 areas, whether it's research, education, practice, or advocacy/health policy. So I became chair of the fellows last year, and it's an honor and a privilege, and we have about over 800 fellows now that really do a lot of the brainstorming for AANP. We're involved in pretty much every aspect of AANP as leaders. We're considered leaders in our profession. And so, I've been a member of AANP since I graduated in 1994, so it just is natural that I continue to support and be a member of AANP. The fellows really are in a unique position because they become fellows because of their leadership in the areas that AANP is involved in: research, practice, clinical practice, health policy, and education. So we support a lot of the programs and initiatives and committees within AANP. In fact, a lot of the journal articles are written by fellows. Fellows are abstract reviewers and grant and scholarship reviewers. Fellows are on all the SPGs, and most of the chairs of the SPGs are fellows. At this point, the whole board of AANP is made up of fellows. So you can see that our leadership skills and our expertise are really woven throughout AANP. You know, I think one of the best experiences I had was in rural South Carolina. When I graduated in 1994, I was looking to move out of Florida. I grew up in New Jersey, and I've always been kind of a city girl. and I was in Tampa, which is a city, and I really wanted to experience something different. I wanted to be in a rural area, and so I looked at places that were recruiting. I went and interviewed, and they hired me in South Carolina, and it was a National Health Service Corps loan repayment site. So I was hoping to go there and get national loan repayment. And so I moved there, and I moved my family there. The town that we moved to, Clio, South Carolina, where the clinic was, had a population of 875 people. So when we moved there, it was kind of a joke among the people that there was a population explosion, because 5 DuBois moved in, and it went from 875 to 880. And they hadn't had people move into the city in years. Most of the people were leaving. But I had a really great experience. I started there, and I applied for National Health Service Corps loan repayment, and I was refused. They said, you know, we don't have any more slots open. I didn't realize it was competitive. So this little town's board went to, at the time, Strom Thurmond was the senator, and he was, I believe he was on the Appropriations Committee. Anyway, he was involved in a lot of things. He was very powerful. And this little tiny town board wrote him a letter and said, we recruited her. We thought, you know, we promised her National Health Service Corps loan repayment. We didn't know she wouldn't get it. What can you do? And within a week, I had a call from the director of the National Health Service Corps loan repayment program saying I had been approved. So, I mean, there's so many things that can happen as a nurse practitioner if you really go for them and look for them. And so, you know, I just encourage people to follow their passion. That's the biggest thing. If you don't do what you're passionate about, I'm not saying you won't be successful, but it won't be as sweet. So, you know, follow your passion. Go in directions you may not think are typical. Think outside the box. Use your experiences. And as Ellen DeGeneres says, be kind to one another. Really, be kind to yourself, be kind to your staff, be kind to your colleagues, and be kind to your patients.